Good morning, everybody. Pat Zemer here with Magna Wave for our next installment of Magna Wave Office Hours. I'm going to do this every Tuesday from 9 in the morning and then again at 2 in the afternoon. I want to go over a couple of things here first before we get going. First, I want to introduce myself to those of you who may not be familiar with me or totally familiar with Magna Wave. I've been doing magnetic therapy since 2002. We started Magna Wave as a brand in about late 2006, 2007, and we've been doing it ever since. Myself personally, I've been a 3-time best-selling author with various books and various topics, one particularly about Magna Wave and PEMF therapy. I'm the founder of Magna Wave. I've been also a practitioner of this therapy. I've treated thousands of horses and people over the years, and I'm very excited when I get to talk about treating horses and people and small animals and the wonderful effects that can be achieved when doing that. I've got post-college studies in microbiology and pathology. I was once an EMT and studied to be a paramedic, so I've got a pretty good background with the medical side or the medicine side or the treatment side of various indications and various things. We certainly don't diagnose in our business, but it's good to have a nice background so I can discuss what we're talking about when people have questions and so forth. So speaking of that, if you have any questions this morning, simply type them into the Facebook page that you're viewing this on, and they'll come up and we can answer those questions for you as you ask them. I do know that once in a while someone will have a question, they want to ask it, but they don't want to have their identity tied to the question. So if you have a question that you'd like to ask, send it to magnawave1@gmail.com. That's magnawave1@gmail.com. It'll come up. I'll see it on my page here and on my page, but my email, and then I'll be able to answer that question for you. Be happy to do that. We want to answer any questions that you might have at this time, whether it's about products, about our training courses, about specific machines, about comparison between various machines, various modalities, some of which I'm going to cover as we proceed this morning. Also, to that end, I'm prepared for the program to go an hour if we go that long. But if we move along and it's smoothly and we've answered most of the questions in 30 minutes or so, then we'll stop at that point. So we've got a nice, concise type of program to redistribute, or someone can watch in a relatively brief period of time before we slice it up into smaller segments. So again, ask questions on the Facebook page or magnawave1@gmail.com, and we would be more than happy to get those questions answered for you. A couple of things that people often ask me is they'll say, well, what is Magna Wave? And how, just tell me what it basically does. And I'll do that. And we kind of use this, many people use this as an elevator speech when they're talking about PEMF therapy or Magna Wave. But Magna Wave basically creates a pulse of energy that's very similar, or the same energy that your body creates, which does two things. See, our bodies are immersed in energy from the earth, so we need this energy. We need this pulse. So Magna Wave helps stimulate that and bring that energy to your body. First, it helps the blood pick up oxygen. So better oxygenated blood helps cells function more efficiently. If you've got well-oxygenated blood, your blood can be healthier. Well-oxygenated blood also takes away inflammation. Both of these functions allows your body to more easily heal and potentially become more healthy and pain-free, which is the result that basically people are looking for. So basically, Magna Wave creates a pulse of energy. That's the same energy that your body creates, which does two things. Helps pick up blood oxygen, and second, it helps the cells function more efficiently. And both of these actions in the body allow the body to more easily heal itself and potentially become more healthy and pain-free. So that's basically what happens with the PEMF treatment. So I'll take a look here and see if we've had any questions as we're moving through. It's hard for me to see. I need to put this away for a second to see if we've got some questions. Let me move this out of the way. Don't see anything at this point. And again, questions are available on magnawave1@gmail.com should you have any questions. So, you know, the basic function, which I was kind of describing to you, and I'll go over another thing. When people quite often, they'll ask me a question, well, how do I've had a back surgery, or I've had this happen to my leg. What should the protocol be? Well, it's always quite interesting. In fact, Erin Hughes, who's the director of training for us, she helps put together materials and help people with the hands-on training as well as that I do, and this type of thing. She always says, someone asks her, well, what's the protocol? And her answer was one day, put it on and treat it. And you know, really, we can say a lot of things, but that's basically the answer. You want to approach the animal, approach the person, approach the small animal, put the coils on, make it comfortable, and treat. And treat comfortably. Some people think, do you have to turn it all the way up to where you're getting all this not violent, but all this big reaction? And no, you don't have to do that. Do we want reaction? Well, sometimes you want to get the energy in there deeply and comfortably, so it's beneficial to the folks that you're treating. And so I always say you want to apply as much energy as comfortably as possible. And that kind of answers that question. How often should you treat? Well, you treat as often as necessary to improve function, to when you see something getting better. However, an initial reaction to or initial point of that question may be, okay, you just treat one time and we're done, or one and done? No. That can happen. I mean, I've had situations over the years where I've treated a person's back or an animal, and one treatment, and bingo, they're good, and it doesn't seem to reoccur. That's wonderful, and that can happen. But in many cases, you're going to need to treat several times, whether it's 3 times or 5 times, and then you start seeing an improvement and things are getting better. And then do you stop? Well, if it can still get more improvement, then you keep treating at that point. Dr. Dreesen says, well, you treat as long as function continues to improve, which I think is incredible. So what's a basic protocol? Put it on and treat it. How long do you treat? As long as function continues to improve. Pretty simple, pretty basic, but that's really it. Now, what does that cover? It covers pretty much everything. I mean, we're talking about a cellular organism of the body, and so we want good, healthy cells. If we treat those cells, they'll be healthier. The body will be better able to heal itself and treat itself. So that's the protocol. It's very difficult to say, well, you're going to treat this knee injury, and you put it on there 4 times for this length of time at this intensity, and bingo, you're done. Everybody is different. So you learn as you develop with this device. You get more comfortable and you learn. This is the kind of result that I've had on legs. This is the kind of result I've had on low back and those types of things. So that's kind of how we describe. There is no specific 2 reasons. There's no specific protocol for a specific indication or condition. Number 1, we don't treat conditions. We help the body be better prepared to heal itself. If we go out and do specific conditions or indications, then we're potentially, someone could say, well, you're overstepping your bounds because you're saying this is what it's going to do. What we want to do is approach various issues and try to help the body better heal those issues itself. So I think it looks like we got a few questions, so let me take a look here and have a look at the questions.
Serena McCann.
Let's see. Okay, yes, Serena. Does Magna Wave help with bone fractures? Most assuredly. The modality. And when we talk about modalities, meaning there are various devices that use PEMF that are approved by the FDA to treat specific indications. And bone fractures is an area where there is a modality, a device that does treat that and help the healing process. All the rest of the PEMF devices, like Magna Wave and other devices that offer PEMF entry or PEMF to the body, can also be very beneficial when it comes to fracture healing. In fact, it's been said that it speeds up the healing, or allows the body to speed up its healing of the fractures that the body has experienced. So to answer your question, most assuredly it is beneficial. Okay. Let's see, is there another one in
it for
there?
now.
Pardon me?
That's it for now.
That's it for now. Okay, I got Nick Stover here, one of our marketing folks, helping me with questions and so forth this morning. So if you have a question, be sure to put it up there, and I'd be happy to answer it for you. Again, post your questions here on Facebook, or if you'd like to send something through privately, send it to magnawave1@gmail.com, and I'd be more than happy to answer the question. Another question that we get asked often is, what's the difference between low-powered machines and high-powered machines? What is the comparison between Magna Wave and Beamer? That seems to be the one that we get all the time. Certainly there's the Eimers machine, the QRS machine, the Curatron machine, many different types of devices that are considered to be low power. What that means is low voltage, low frequency. Most of the time with the low-powered machines, you don't feel anything. And the treatment times run 30 minutes. Some of them say 15 minutes twice a day. Others say 30 minutes to an hour every day to achieve the results that you're looking for. They're fine machines. They produce a good feeling. They relax you. But if you're looking for a reversal of inflammation or a reversal of pain, they're not fast. I'm not saying they're not good, and I'm not saying that everything against them. They're just not as fast as high-powered machines. The high-powered machines are considered high-voltage, low-frequency devices. And so those devices, when you use them, you will feel them. You'll feel the pulsing on your body, and you'll see the movement of the joint or the muscle area on a person or a horse or even a small animal. And that's the basic difference between the two machines. What is the result difference in the two machines? Well, the high-powered machines, like the machines that Magna Wave offers for most of our machines, we do have a couple of low-voltage, low-frequency machines in our line, but the high-powered machines really produce, in many instances, an immediate relief of pain by allowing the body to take on more oxygen and let that oxygenated blood help reduce inflammation within the body. Then you'll get a quicker relief of pain and a decrease in the swelling that is so often associated with pain. Inflammation causes almost all pain. So when you have pain, you've got inflammation somewhere. Work on that inflammation. There's also a question that quite often comes up is people will say, well, I'm told that more is not better, and I'm told that the lower voltage, lower frequency devices are actually better for healing. Well, let me go back and approach that for a second. And again, if you have any questions, please feel free to post them. But let me go back and talk about that issue of the lower frequency is better to promote healing. The first thing is almost all studies that were done over the last 20 years, 20 or 30 years, of which there's a plethora of them. If you go out to various sites, PEMFinfo.com, put it into Google, something in PEMF, and you'll see various studies that were done. Most of the early studies were facilitated with lower power equipment. And if you go back and read those studies, you'll see that they talked about longer treatment times over longer periods of time, more weeks, treatments every day for 30 minutes to an hour or even twice a day. And they had good results because they could extend it over a period of time. Now, you bring in the high voltage machines and you say, okay, I want to treat this same I want to work with this same indication to see what happens. Number one, there are not many studies at this point. We have conducted, our company and our sister companies have conducted actual studies utilizing our equipment in Cuba. We have studies that our manufacturer, with the help of the distributors of the manufacturer, have 3 studies that are ready to take place immediately in 3 hospitals in the U.S. that we're going to use for our CE approval in Europe, and we're going to use for our FDA requests in the United States. A lot of companies, you'll notice, if you ask, have not done studies and don't have any studies on the table. They're relying on third-party studies. However, with that said, when you look at the studies with the high-powered equipment, the results are basically the same. Now, when NASA did their study, when Dr. Bob Dennis did the NASA study, and it was all finished and completed, there was notation and documentation that it appeared that the lower frequencies helped healing a little bit, that they just maybe helped the healing occur. We've always said, once you get ahead of what you're working with, if you've got an indication or something that you want to see improve and you're treating the body so the body can better heal itself, and you get the body with less pain. Quite often, if you get ahead of something that you're doing and you're using the high-power device and you want to use a lower power signal or a lower signal to help enhance the healing process, by all means, do that. Our equipment is very well equipped to do low frequency as well as high frequency. To say that low frequency is the only way to do it, it is like saying there's only one seasoning to use in your spaghetti, and if you don't use that seasoning, then your spaghetti is not any good. We all know that's not true. So you can use various types of seasoning when you're working with your recipes, and it's the same way with PEMF. Of course, if you got a device that doesn't produce high power, then you're going to say that the low frequencies are better for healing, and just take the time. Spend the weeks it takes to get the ultimate result, and you'll be happy in the end. That can work. But we've learned that people like more of an immediate response to what they're doing and what they're looking for. So if you have any questions, put them in the Facebook page, or send them to magnawave1@gmail.com, and I'd be more than happy to answer those questions. So there's some questions that often come in as well dealing with other modalities that are not PEMF. Those modalities would be microcurrent and TENS. And so here's where there is a difference there, and I'll try to explain one of the differences. A TENS unit is a unit where they'll put something on your body. They'll put it here, and they'll put it here, and they'll be basically working on one muscle group or one area. And a TENS unit is designed to flex a particular muscle group that is in pain or around where you're experiencing pain, and it's to help relieve pain. And TENS will do that. So a lot of people will use TENS units on their lower back to help relieve pain, or their shoulder, or wherever they may have it, and they get the result that they're looking for. Are they getting everything around that area? No, not necessarily. To do that, they'd have to be moving that TENS unit all over the place to be working on the other areas. But if there's no pain there initially, but could it be a referred area? Where's that pain coming from? So that's the difference. When you put a TENS unit on, you're basically going, let me put it this way, you're going right here and right here on that particular muscle group. When you put a PEMF device on, or a Magna Wave PEMF device, a round coil, you're penetrating the entire shoulder. You're not only getting the muscle that you're treating, but you're getting the tendon, the cartilage, the fascia of the muscle, the bone, any place in there, you're getting the whole thing. You're penetrating everything. And that's what makes the treatment with PEMF so often, I don't want to say superior, but makes the treatment of PEMF work so rapidly, because you're doing everything into that area. So what about microcurrent? Well, microcurrent works at the cellular level. And microcurrent is actually designed and shown to be able to promote healing. And so if you put that microcurrent, and quite often it's the same way, you'll have a pad or a group of pieces that you put on the area, and you turn it on, and sometimes you feel it, sometimes you don't. It's a little electrical charge that is penetrated into the body as microcurrent that the cells are receptive to. And so again, you can go into that area and treat that area with microcurrent, but you're not necessarily getting everything, or you're not necessarily penetrating through the whole area. Microcurrent may go in a certain area and stimulate that, which is beneficial. And I would always say very complementary. There's a lot of folks who will use PEMF, Magna Wave type PEMF, along with a laser or microcurrent or TENS units to be complementary in their processes and to work well together. Again, it's like a good balanced diet. You need your meat, you need your potatoes, you need your vegetables, all to nourish you in the proper way, depending which type of diet you're on. But that is the case and what happens there. So again, the microcurrent device is designed to heal. There are some devices that offer microcurrent and TENS at the same time, so you can put it on the area and get a little bit of both. And again, as a complementary modality to the Magna Wave PEMF could be very beneficial to the clients that you're working with. Again, whether that be small animals, people, or humans. So I hope that clears up a little bit. Those are questions that we get a lot, and we're happy to answer and try to bring those questions so you have a good understanding of them. Again, questions, magnawave1@gmail.com, or right here on the Facebook page. We'd be happy to answer them for you. So another area that we often get asked is, how does Magna Wave compare to Shockwave? Is Magna Wave Shockwave? And the answer is no. People often confuse PEMF devices with Shockwave. In fact, we've had various over the years. Several years ago, with the FEI, they couldn't quite figure it out, and they felt like Magna Wave and Shockwave were in the same category, so they made it so PEMF couldn't be done at FEI events for a period. It wasn't ever banned or ever blocked, but they questioned how it would be used at those events because Shockwave could not be used during an FEI event. It had to be used prior to the FEI event. Well, once that was clarified, everything was fine. But the difference is, Shockwave is better for it. Quite often, it's a result of sound waves. In some cases, it's a compression device, and basically, it is hitting on the body, whether it's wherever it happens to be. It is doing that. In many cases, it's considered invasive because it does really hit the muscle hard. It really does. It's uncomfortable, and if something's uncomfortable as it goes into the body, they quite often consider it invasive. Or if it can cause, if you got to tranquilize or do a pain retardant before you do it, it's considered oftentimes to be invasive. And that's what Shockwave does. It clicks. Our type of device clicks. Difference is we're putting a magnetic field into the body which penetrates the entire body and is comfortable. It's non-invasive. And so that is the difference. Shockwave, Magna Wave, click, 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 but you don't have the invasion of the tissue. Hope that answers that question that we get quite often. Did we get a question? Oh, no other question at this point. Well, we're in 25 minutes. I said if we have some good questions, we will answer them. Those of you who have been able to join us this morning, we're certainly glad that you did that, and we always want to be together here to answer your questions. We know this is a new process. People need to get used to, I can tune in and ask my questions at 9 o'clock or 2 o'clock on Tuesday mornings and Tuesday afternoon. And that's why we're doing this. We want to make it available at that time as a learning process and a place to get questions answered. So I really have enjoyed this morning. I'm sorry we had a little break in the action when we lost our internet for a minute, but I certainly enjoy being here with you, and I look forward to. Did we get a question? No.
How does Shockwave heal compared to MW?
The question is, how does Shockwave heal compared to MW? All right. The reason for the Shockwave is to go into the area where they're looking for, stimulate the area, cause the area to cause oxygen or oxygenated blood to go to the area to help the healing process. That's what they're trying to do, is to create an action that draws blood, oxygenated blood, to the area to do it. Well, if the blood that's coming to the area isn't as healthy as it can be, it's still got oxygen, it's still going to go to the area, and it's still going to aid in the healing. But if that blood that's coming to the area has the opportunity to be oxygenated very well, then you're going to better approach the area. Now, I'm not a doctor. We don't diagnose. So to say that Magna Wave will heal something more efficiently than Shockwave is not in our bailiwick. Both of them can be very beneficial to the healing process. It comes down to the ease of application, the comfort that's achieved, and the overall result. Of quite often over the years there have been situations where a veterinarian would shock wave a horse, and then we would follow up with Magna Wave after that, taking the horse up to the race day, up to the competition that they're going to be participating in, because it's comfortable, it can be applied every day, and you can keep that horse in the manner that the veterinarian wanted to get it to, or that person or that small animal that the veterinarian wanted to get it to prior to that particular competition, race, activity that someone was doing. So again, can be very complementary between Shockwave and Magna Wave. Is one better than the other? You know, some people have their personal opinions, and that's fine. But actually, the modalities are complementary, and the modalities serve their purposes. Some people don't like how the Shockwave is administered, and they're not comfortable with it. That's fine. But is it proven? Most certainly. And so I hope that answers your question. Was there another question? Yeah, I looked out. That was it. Tony, thank you for that question. Very good question. If I'm giving an example of something and that spurs you to ask with something that maybe I didn't cover in my question or in my response, please just throw up the part that maybe I didn't cover well enough for you. So that was, again, a very good question, Tony. Thank you so much. With that, let's see, it's almost 9:30 here on the East Coast. Those of you, Tony's up early in the Phoenix area, so what is it, 9:30? It's 7:30 there. That's not too bad for, I'm sure she's been up for a few hours already as a horse person. I will take another moment to see if someone who's been able to join us may have a question that they would like to ask us at this point. So it looks like everything's moving along all right. So again, we'll be back at 2 o'clock this afternoon to answer questions or give more detail on various questions that people have. Thanks a lot. Have a great morning. Wave on.